Aloha, guys. This is Dr. Tom coming back at you. Yes, you know I always do. I'm always here. I'm always ready for you. Okay. Uh, this is our PowerPoint lectures for week 3, starting with Unit 6, Chapter 6, Calculating Children's Dosages. All right, guys, let's see what it says. A child is inhuman from infancy to puberty. Infancy is a stage of life from birth through the end of the first year. Wouldn't hurt to know that, because puberty is the stage of life when one becomes capable of reproduction. Boys usually 13 to 15, girls 9 to 16. Okay. Okay, this is real important. We've mentioned this before. We've gone over it before. You need to know this, guys, and just have it down flat, have it memorized. Guidelines for administering pediatric medications, of course. These are the 6 rights of proper drug administration for any age patient, not just children. Right patient, right drug, right dose, right route, right time, right documentation. Now remember earlier there were like 10 of them, and I said that there were like 6 that are really important. These are the 6. Of course, it's true in children as much as it is in any other age group. Okay, guidelines for administering pediatric medications. Carefully assess each pediatric patient for the following: age, weight, physical state, disease process, if any, mental and emotional state, level of understanding, and of course, allergies. Guys, when dispensing medication, particularly, well, any kind, but I think parental, injectable meds, allergy is real important. You must check for it. The patient's chart will have a big fluorescent orange or pink or some notice if they have an allergy. Why? Because it could potentially even be fatal. It could set up anaphylactic shock. Guidelines for administering, let's see, continued. Gain parental cooperation in the following ways. In other words, guys, the parents have to do their job too. Identify yourself. Call the parent and the child by their name. Explain the procedure, what you're going to do. Allow the parent to assist. May need to have the parent leave the room. Why? Sometimes the kid will behave better if the parent's not in there. It just depends. You have to use your own judgment on that. Number 4, establish a rapport with the child in the following ways. Be straightforward and positive. Don't lie to them, guys. If you're getting ready to give them an injection, don't stand there like a dummy and say, now this isn't going to hurt. You're not going to feel a thing when you know damn well it's going to hurt. A little bit. Actually, guys, modern hypodermics are only used one time and disposed of. They are very thin and very sharp, and they really don't hurt much. But to a child, Be straightforward and positive. Do not waste time. Explain at the child's level of understanding. Allow the child to assist, if you can. Show approval for positive behavior. Okay, guide number 5. Route of administration depends on, well, the first thing it depends on is what the doctor told you to do, but other than that, age, weight, body size, physical, mental, and emotional state, disease, level of understanding, properties of medication, of course, physician's order. A lot of it depends on what they're suffering with, guys, and what kind of problem they're having, what type of medications they have to be given. And then, like a small child can't swallow a pill, for example, so, Speaking of swallowing a pill, the oral route, never force or give to the child if they're crying. What are some of the options? Liquid, dropper, syringe, or medicine cup. Solid may have to be crushed and mixed with food or liquid. Always ask pharmacists prior to mixing. Why? Because you might be mixing with something that might inhibit the medical action of the drug. Do not mix medication into an infant's formula, their bottle. I guarantee you that happens. Let's see, parental route. Now remember, parental route basically means injection. When you see that, think injectable drugs. Requires 2 people. Why? Because that kid is going to be fighting you probably. 1 person to administer the meds, 1 person to maintain the body's position. In other words, to hold the kid. Rectal route. Consider how the child feels about this part of his or her body. May be embarrassing for older children. Younger children may resist. Yeah, I'd say that there's an inborn instinct against something being shoved up your butt, probably, even in very small children. Of course, a lot of this, it depends on the type of med, guys. For example, a child that has got quite has projectile vomiting. You can give anti-nausea meds, but if they're vomiting, you give it to them, they're going to vomit right up. So sometimes it has to be often given the other way. That's an example when of course, the doctor will make those decisions. New dosage forms of medication. They realize, guys, that this is a significant problem, and they're working on it. Long-acting formulations. Let's see, delivery devices formulated for easier use. Melting tablets, fixed-dose combinations, inhaled mists, long-lasting formulations where you don't have to give it as often. Because it's a real problem, guys. Children have to be pretty good size before they can swallow a pill. There's adults that have trouble swallowing pills. Okay, calculating children's dosages. Now, on the exams, there will be some questions on this. It's all very simple. It only requires the simplest of arithmetic. Okay, the first thing is a lot of drugs are milligrams or milliliters per kilogram of body weight. And of course, chances are the patient or the child or whoever, their weight's going to be recorded in pounds, so you got to convert it. How do you do it? It's simple as pie. You divide the pounds by 2.2, and that will give you the kilogram. A kilogram is just slightly less than half a pound. So you divide their weight in pounds. Let's say they weigh 100 pounds, divide 100 by 2.2, and that'll give you their weight in kilograms. Then you can use that to figure how much meds to give. Multiple dose ordered by kilogram weight. If ordered in divided dosage, divide by the number of dosages. And that's it, guys. Now, there's some in there that's a little more complicated, but not a whole lot. Okay, medications used for cardiovascular system disorders. Heart attacks and strokes. Cardiovascular problems are a leading cause of disease in industrialized nations, and that includes, of course, the United States. How drugs affect the heart. There's three things here, guys. You went over this in pathophysiology, but let's quickly review. Inotropic effects means increasing or decreasing the amount of the myocardial contraction. So inotropic is how hard or not so hard the heart contracts. Whoosh. Chrono means time. If you'll remember that, that'll help. Like a chronometer is a fancy word for an expensive watch. Chronotropic affects an increase or decrease in the rate. And then dromotropic deals with the conduction of the electrical impulses in the conduction system of the heart. So let's go over these quickly. Inotropic is force of contraction. Chrono is how fast it beats. Dromotropic has to do with regulating the flow of the nerve signals down through the cardiac conduction system. And there are drugs that increase or decrease these three things. Cardiac glycoside, digoxin, I guess is how you pronounce it, guys. Usually for congestive heart failure. CHF, it's abbreviated, is very common. A lot of older people have it. It strengthens and slows the heart muscle, improves myocardial muscle tone, used in conjunction with diuretics or water pills that make you urinate out additional water, while all that extra fluid overloads the heart. And if you have a weakened heart, it makes it worse. So they give these patients diuretics to help them get rid of a bunch of extra water and fluid. Most common side effects of toxicity: anorexia, nausea, vomiting. Arrhythmias means abnormal rhythms, muscle weakness. Okay, this is a very common condition, guys. Very common. It's abbreviated CHF, and that's common. Okay, now also the rhythm of the heart is real important. An arrhythmia is an irregular heartbeat, and it can be serious. Antiarrhythmic drugs help regulate heart rhythm. Not all arrhythmias require treatment. That's where a cardiologist, guys, would be the doctor to make that decision. Examples, I'm not familiar with any of those, but just try to recognize them, guys, and realize that those are for cardiac problems. Okay, vasopressors and vasodilators. Vasopressors have to do with blood pressure. Think of pressor, blood pressure. They cause contraction of muscles associated with capillaries and arteries. Why? Because capillaries and arteries have muscles, veins don't, or if they do, is not much. Useful to help elevate blood pressure in treatments of shock. So even though there's a lot of hypertension problems with high blood pressure, there are times that the blood pressure drops too low. a patient going into shock is an example of that. Vasodilators dilate the blood vessels. Used in treatment of peripheral vascular disease, that's what this is, and angina. Angina or angina, it's pronounced both ways, is where there's chest pain on exertion because the cardiac muscle is not getting enough oxygen. Why? Probably the coronary arteries that feed it are clogged up. The most common vasodilator, coronary vasodilator, is nitroglycerin. Yes, I know it's an explosive, but it also, I don't know if it's exactly the same, but it'll help dilate those blood vessels, and that'll help hopefully get more blood to the heart, but also can reduce hypertension. Speaking of hypertension, antihypertensive drugs. Now, guys, high blood pressure, hypertension is a huge medical problem in society. Diuretics, get rid of the fluid, some of the excess fluid, and hopefully you have less pressure. Beta-adrenergic blockers, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, calcium channel blockers, alpha-adrenergic blockers, nervous system inhibitors, peripheral vasodilators. Okay. There's lots of different ones, guys. Drugs that affect the blood, okay. Anticoagulants. Guys, what did I say the leading cause of death was? Cardiovascular. A lot of that's due to blood clots in the heart and in the brain. So anticoagulants, it's important to keep blood clots from forming in a patient who may have that tendency. So anticoagulants prevent formation of clots. They keep existing clots from increasing in size. However, they do not dissolve clots that are already there. Thrombolytic agents do. Remember, lysis or lytic means to destroy or remove. Dissolve existing fresh thrombi. Now, a thrombus is a blood clot, and emboli are blood clots and other things like bubbles and stuff that are free floating in the vascular system. So a thrombus is a clot, an embolus is a clot or other things that are broken loose and floating, which is not good. Diffuse into clot and activate plasminogens. That's part of the clotting mechanism. Heparin is a blood thinner produced by mast cells found in the liver and lungs, used during open heart surgery, renal hemodialysis when you go to get your kidney treatment where you have to be put on dialysis. Treatment of deep venous thrombosis. Those are blood clots forming in the deep veins of the legs, which is where they most commonly form. Pulmonary infarction would be a defect in pulmonary circulation. They can be given subcutaneously or by IV, but never intramuscularly. Why? I'm sorry, but I don't know. Dosage should be adjusted based on the patient's coagulation test results. Of course, they can test for all that. Be aware of the signs of bleeding. Petechia are little pinpoint dot hemorrhages. Ecchymosis is the medical word for bruising. Black tarry stools. Why? You got bleeding in the stomach going on. And that's a sign of that. Bleeding gums, blood in the urine, hematuria. Warfarin or Coumadin are the same thing. It's also a very common blood thinner that a lot of people are on. Oral anticoagulant acts by inhibiting synthesis of vitamin K. Vitamin K is made in the gut. It plays an important role in blood clotting, so if you can inhibit that some, it'll hopefully keep the tendency to clot down. Use prophylaxis to help prevent it or for treatment of deep vein thrombosis. Pulmonary embolism, guys. A deep vein thrombosis means you got blood clots in the veins of the legs. Pulmonary embolism means a blood clot or something else has broken off and gone through the heart into the lung and clogged there, and that can be very serious and fatal. AFib means the heart's beating irregularly. Patient teaching, avoid salicylates. Those are aspirin. Why? It has a tendency to thin out the blood. You might thin it out too much. Large amounts of green vegetables. Why? They have vitamin K. We're trying to inhibit some vitamin K. May discolor alkaline urine reddish orange. Watch for signs of bleeding. I wanted to finish this up, but I'm not going to be able to. But that's okay. So, guys, the problem is that if a person has a tendency of blood clot, and you can keep it from clotting, you diminish your risk of strokes or heart attacks. But if you give too much, they can start bleeding. And I knew a guy that died from that very thing. From not having it, wasn't going to the doctor and regulating it well enough. Okay, we're about out of time. We'll pick this up in a moment. Dr. Tom signing off.